Doctors of Reddit, what is something that you wish everyone knew about their body? This one is more about medication. Antibiotics only work against bacteria. They are not some kind of wonder potion that cures anything, and they should not always be given. Please stick to your prescription the doctor gives you. Even if you already feel better, don't just stop unless the doctor says you can stop. A lot of medication needs to be taken according to the prescription in order for it to be effective, because you build up the doses to an effective level. Stopping or not sticking to it really decreases effectivity. Tell us what drugs and alcohol you're on. We aren't going to tell the cops, we aren't going to lecture you, but it might change the anesthesia I give you. Some stuff I give you might kill you. If you drink a 30-pack a day, tell me 2-6 love. Ejaculating blood happens to most people at least once in their lives, and in 99% of cases, it resolves without taking any action within a week. It doesn't even warrant a doctor visit. Peeing blood, for both sexes, is a serious medical emergency, and you should immediately go to the ER. People think it's the other way around. How to eat healthy. Just because you're skinny doesn't mean you're healthy, especially the teenagers who I take care of. Sometimes I'll ask them, what's a healthy food your doctor wants you to eat? Rarely do I get a right answer. I feel like the internet has so many fad diets and family members rarely cook, so families don't know basic nutrition facts. That there is a wide range of normal. Don't be embarrassed by your body. Having said that, if you are concerned about anything, ask your doctor. We've generally heard it all before, and trust me, we have, nearly always, seen it all before. Maybe you have something that's been bothering you for ages, but you were too scared or embarrassed to ask about it. Just ask. It might be nothing, and you've been stressing about it for no reason. And if not, then you're at least one step closer to getting it fixed. No one can help if they don't know. There are no stupid questions, so ask away. I'm always amazed when I've been asked about something that has been bothering a patient for years and years, but they were too embarrassed/scared to bring it up. Most of the time, it's nothing/a completely normal body function/feature. Other times, it is something that should have been discussed right away. You know your body best. So speak up. Don't wait for the doctor to ask the right question. My phone is acting up, so if this has already been posted, I apologize. But women, please do not use soap or douching products inside your vagina. It has a delicate pH balance, and this is how you get yeast infections. Wash your labia, but do not clean internally. The vagina is self-cleaning, just like your eyeballs. Do you wash your eyeballs? No. Do you wash your face? Yes. Some people seem to think that if you act healthy for a bit, it'll make up for being a wreck. There's so many things wrong with this. Just one example. Antioxidants are like gas for your car. You can store up a certain amount of vitamins, but your tank can only hold so much. If you binge and overfill your tank, it doesn't do anything. You excrete it out as waste. And you can't expect to go the next several months without gas just because you tried to overload it before. You're going to still need to get gas. Same goes for your fruits and veggies. Had someone tell me he went vegetarian for a few weeks, which meant he was done for the year. He was dead serious. Had a patient at risk for heart failure try to insist that if she stayed away from salt entirely for X days or weeks, she should be able to have her fill of McDonald's fries and ramen. Had a smoker argue that if he stopped for some time, he should be able to smoke freely for a while. With some digging, stopping turned out to mean a couple less cigarettes a day. I think there are a lot of obvious ones, like how lifestyle choices in your 20s impact your health and quality of life in your 40s. It would help if more patients knew their family history, though not everyone has this opportunity, unfortunately. Prevention is becoming more and more important in medicine, and treating a disease in its early stages is a lot better than catching it late. If you have family members who had ovarian or colon cancer in their 30s, that is very significant for your own risk. The screening and tests we run might change, depending. If you want to start the pill, it's important to know about breast cancer, DVTs, clotting disorders in the family. If you're a bit overweight and have no metabolic syndrome problems in the family, compared to a bit overweight but both your parents have type 2 diabetes and cardiovascular disease, the management priorities change. Asking your family about any reoccurring diseases or diseases that occurred early, 20s, 30s, maybe 40s, can be helpful. There are certain common conditions that are underdiagnosed but easily fixed. Even if you have nonspecific symptoms, it doesn't hurt to tell your doctor during the next visit. About 5% of U.S. adults have an iron deficiency, which can cause loss of concentration and fatigue, and a huge amount are vitamin D deficient. When I am able to complete a systems review, ask screening questions about every different body system, I end up discovering a lot of irritable bowel syndrome, hypothyroidism, insomnia, joint pain, headaches, etc. that impact quality of life. But people don't bring it up because they don't want to be a bother or think the symptoms are too vague. It's not a bother, and often, but not always, these conditions have simple treatments which can really improve how you feel. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. How to check for skin cancer. If you see any moles or anything that are A. Asymmetrical, B. Odd borders like they're jagged or something, C. Color, different colors, D. Diameter, grows, E. Evolves. Go get it checked out. It might be skin cancer. There is no cure for cancer, as it is traditionally thought about. Cancer is a class of many very different diseases, each with very specific causes, i.e., some molecule that went wrong, allowing a cell to multiply out of control. Even within the same type of cancer, i.e., lung cancer, there are many types of lung cancer, such as small cell, large cell, squamous cell, etc. Even within the same subtype of cancer, there can be different molecular mechanisms that caused it, requiring different approaches to treatment. Looking for the cure for cancer is like looking for the cure for disease. This is going to sound really basic, but I wish my patients would know what meds they are on when they come to the hospital. At least once a day comes somebody in who goes, "Yeah, I take 8 pills in the morning, 3 in the evening, and 4 at lunch, but don't ask me which. You're a doctor, you should know." I beg of you, before going to a doctor that has never seen you before, write your meds, doses, and all on a piece of paper. Edit. I was on shift and just now noticed that this blew up. Just to clarify, I work in Germany on the internal medicine ward. I can only see patients' record if they were in my hospital or in the neighboring hospital, otherwise I have to call their family doc, who may or may not be at all times available. I mostly just send a family member home to bring the goodies bag so that we can go over them, but as you can imagine, that takes a lot of time. Thank you for the silvers. I shall treasure them forever. I'm a vet, but I'm sure some doctors will have come across this too. Amputated limbs do not grow back. I've had far too many people asking how long it will take for their pet's amputated limb to grow back, so I'm assuming a few doctors out there will have had patients asking the same of their own missing limbs. You only get one body. The way you treat it has a significantly higher impact in how your health will end up in a decade than what sort of interventions we can give you. You really should treat your body like a temple. That the immune system is an incredibly complex and nuanced organization of cells that communicates readily to destroy anything deemed hostile within the body. It helps explain why vaccines are supposed to work, why allergies come and go, and why transfusions/transplants are hard to successfully pull off. Edit. A lot of people are asking how allergies work. So here is a brief explanation using pollen, allergic rhinitis, as an example. Your immune system senses pollen in the body. It doesn't appear to be one of your cells, so the B cell collects samples of it, relays it to a helper T cell, which in turn helps specialize the B cell to become one of 2 cells, effector and memory cells. Effectors mass-produce antibodies, while memory cells are reserved for future invasions. This is why initial exposure to a new substance may not necessarily trigger allergic responses. The signal is still weak, as the immune system is still acclimating to a foreign particle. Antibodies flood the pollen particles and signal for basophils/mast cells to release histamine, the hormone responsible for inflammatory responses. This is where the runny noses and sneezing come into play, and for more severe allergies, anaphylactic shock. Allergies may fade out over time for several reasons. When exposed to a non-threatening level of an allergy for a long enough time, the body decides that it's not really a threat anymore. Furthermore, as people age, the immune system weakens, making it harder to detect and overreact to allergies, untreated hypertension, and diabetes. Oh, and cocaine/crack. The coronary vasospasms will do a number on your heart.